Welcome to Biztech's Health and Wellness Show, where we focus on equipping you with the knowledge on health and wellness to help to ensure that you are more productive and healthier for yourself, for your families, and for your employees. Today, the conversation is about looking after your heart and how there are tools out there to help you to monitor your heart health from your home. Now, to bring expert insights, we have Dr. Gary Lee, the consultant cardiologist and electrophysiologist at Thomson Hospital in Kota Damansara, and Alvin Lee, CEO of BioD Medica. Now, gentlemen, welcome to the show.
Right.
Hi, have a good evening all.
Yeah.
Gary, I'm going to start with you.
Sure, Ryan.
Could you just explain your area of specialty and share a little bit about your background?
Okay, sure. Thanks, Brian, for the kind invite as well today. I'm very glad to be speaking to our dear audience as well. So basically, people used to ask me, you are a cardiologist, but what is electrophysiologist? So I always tell them I wear two caps. One cap is I'm a plumber, so I do all coronary intervention, things people talking about, angiograms, angioplasties. If you have blocked vessels, we open it up. Those are the plumbing work. I tell them, apart from that, I do also an electrician work. So I'm really wearing a two cap. So if you have abnormal heart rhythm, palpitations, where you have electrical problems within the heart chambers, that's the time you call for a cardiac electrophysiologist to come in and deal with it. And then that's very relevant to the topic that we are talking today about atrial fibrillation, which is exactly, in true sense, an abnormal heart rhythm condition itself. Yeah.
Okay, Gary, I'm going to come back to you about atrial fibrillation, but I want you to give us some insights from a macro level. How are Malaysians currently impacted by heart health? Because we have generally rather poor diets.
Correct. Rather than saying being a poor diet, I would say we are rich with good diets, which is, of course, then contributes to a lot of what we call arteriosclerotic heart disease and things like that. So a lot of times, we do see that from the National Health Mobility Survey that has been carried out from years onwards already. We do realize that the heart problems tends to predominate the statistics that's being churned out every year itself. And it actually boils down to the fact that we have a lot of risk factors that carries and predispose one to actually this kind of heart problems itself. So the problem is, that only underlines the fact that we do not pick it up early. We tend to ignore the symptoms which comes about, and then when the time symptoms becomes a bit more apparent, that becomes a bit too late for us to do something about it. So we do see just not only the incidence, but the prevalence of the heart disease actually becomes a bit more common nowadays. And most of these heart disease we are talking about is actually vessels blockage, heart failures, abnormal heart rhythms, and so forth, you see.
Now, how are these risk factors identified?
Well, most of these risk factors are identified if ones are more vigilant on looking at their health conditions. For instance, those who do go for health screenings, do for routine medical checkups, they probably pick it up much early at an earlier stage where you probably can do something more before it sort of becomes a bit more progressive in nature. And having said that, most people at the early stage of their conditions, or for instance, hypertension or diabetes, you probably will not have any symptoms. So it really boils down to being vigilant on looking at your own health and trying to go for routine medical checkup. That is when you really pick up all these problems and treat it well before, it sort of propagates into a more severe form of disease.
And Gary, when should we, from an age perspective, a time where we start to be more aware about getting regular checks on our heart?
Brian, if you were to ask me this question 20 years ago, I'd probably tell you don't bother about checking your heart until you are 50 or 60 years of age. But nowadays, we are seeing younger patients coming to us with heart attack, heart problems. Therefore, it's never too early, I would say, to go for a routine medical checkup. Especially if you do have risk factors, if you tend to be overweight, you have family histories, you have some unhealthy lifestyles or dietary intakes, these are the time you should be a bit more vigilant and do it much earlier. And just to share with you, my youngest heart patient is actually at the age of 20. So it is not something too far-fetched for you to do it earlier. Yes.
So Gary, I have a personal experience as well. One of my cousins just went for a bypass, 33 years old.
Yes, that's right. You are seeing much earlier onset in terms of all this heart disease actually. So it's something, it's scary, but this is a fact of life which we need to face nowadays in the era of modernization.
Okay, let's zoom into arterial fibrillation, and why is that awareness? Why is the awareness level rather low compared to heart attacks, for example?
Correct, because heart attacks seems to be more pressing when the symptoms comes. You get chest pain, and people get worried when you have chest pain. And of course, over the years, the campaigns has been managed to actually raise awareness on heart attack. But if you do realize that actually atrial fibrillation, which is an abnormal heart rhythm, where your heart beats in a very chaotic manner, can equally contribute to damage of the heart itself. But often than not, the symptoms of atrial fibrillation at the very early part of the disease tends to be palpitations. And a lot of times, because of our work, our lifestyles, we have been very busy with our lives and so on. Most of the time, we tend to blame it on being unable to get good enough rest. We've been taking a bit more caffeines at that point of time to keep us aware and alert to do our job and things like that. So we tend to minimize the impact or the severity of symptoms of palpitations. But the first onset of palpitation should really alert us. We probably have this so-called atrial fibrillation or abnormal heart rhythm that may actually propagate on and progress on if we sort of do not make a good diagnosis of it and at the same time manage it well right up front.
Okay, now I'm going to move to you, Alvin, and please tell us what BioD Medica does and tell us a little bit about your heart monitoring products.
All right. Hi, Brian. Thanks for the introduction, and I think thanks for the opportunity as well. Okay, for BioD Medica, we actually import and distribute this particular device called Cardia. It looks like this.
Okay.
And this with this device, actually, you just need to place your finger, and with the app installed in your phone, you can actually record your ECG, electrocardiogram, and this tracing or this of this ECG is important, I think, to detect some the electrical aspects, as how Dr. Gary had mentioned, the activity in your heart. So this is the device that we actually are currently distributing in Malaysia, and it's called Cardia.
Okay, can I ask you why would I use your product Cardia versus, for example, using some very off-the-shelf fitness type apps that are linked to watches, for example, the wearables, which should, in theory, give me the same sort of results?
Okay, maybe it's true. I mean there is watches as well as other devices that's available in the market, but in terms of clinical evidence wise, this particular device, Cardia, there is a lot of extensive research being done. I think they do have like more than 80 peer-reviewed articles being or should I say this device has been investigated. And in terms of the algorithm, that is where the key of where a life call lies. The algorithm is able to accurately process the signal that was recorded. In terms of the sensitivity or specificity, in terms of accuracy wise, is almost 98% compared to 12-lead ECG. So in terms of the accuracy wise, yeah.
So and one of the things so I did some research on this, and so the difference primarily is, and so what you're saying is yours is a medical grade signal as opposed to a consumer grade signal that comes from a wearable.
Yes, I think in terms of the how the device itself processes and how the reporting wise of the signal or the tracing of the ECG. Maybe Dr. Gary, you want to comment on this?
Yeah.
For your experience.
Thanks. I actually wanted to add on to what Alvin was mentioning as well. We do have a lot of wearable heart recorder device in the market, and it's now being widely accessible to a lot of people thanks to online shopping. Probably that's one of the blessing of MCOs that we have seen the surge in the online shopping itself. But we do need to understand that there are also limits to all these wearable devices because there are some signals quality is an issue. The reliability of the recording is also another issue. And most of these wearable fitness devices allows you to monitor the heart rate, which is very good. But unfortunately, it's not a thorough aspect of how you monitor a person's heart rhythm. To look at whether someone's heart rhythm is normal or not normal, we basically look at two aspects. One will be in terms of the heart rate. The second is we want to look at the electrical recording of the heart, which of course wearable devices like Cardia Mobile allows you to look at that. And once you're able to look at the recordings itself, the tracings of the electrical rhythms of the heart, your physicians or your doctors, will be able to detect whether this is an abnormal heart rhythm or not. But looking at heart rate itself without looking at the electrical tracing, you will not be able to make a good medical judgment as per se, what is this symptoms related to? Is it really an abnormal heart rhythm occurring for the patients? So this is something that differs a lot when you're looking at using Cardia Mobile to record an abnormal heart rhythm, which doesn't only give you rate, but also the electrical tracing. It is as though I always tell my patient, you have an ECG machine by your side all the time. With that ECG machine, you can always run through and get a recording, and then you probably bring it to your doctors during the visits to the clinics. Then you will sure, look here, this is a time when I have abnormal symptoms, and this is my recording. And what would you decide of this? So that really sets it a bit apart from the most commonly available form of wearable devices.
Okay, now just a disclaimer to our audience. Yep. Dr. Gary is not employed, or does he receive any financial incentive for recommending this product? Now, Gary, you recommend this to your patients. Generally, what age group do they fall? What sort of range do they fall under?
Well, in that sense, most of them, I will recommend it to my patients who actually comes to me with palpitation, irrespective of the age group. Because often than not, as an electrophysiologist, we do realize that capturing an abnormal heart rhythm, sometimes luck does plays a bit of part role as well. So, because often than not, when you start having palpitation, when you arrive at the emergency rooms or when you arrive in your friendly neighborhood clinics, you probably by then, you will not have any more palpitation. And an ECG recording at that point of time will just only show a normal heart rhythm.
Right.
But you will probably miss the boat of diagnosing a real abnormal heart rhythm. So therefore, if my patients at the preliminary investigations and assessment, I find that I do not have a good answer for them that why are they having palpitations? Is it really an abnormal heart rhythm? This is a time I would suggest to them having a wearable devices or having a recorder which they can keep by themselves. And at any point of time when they start having symptoms, they make a recording and they can always even, emails me or send the recordings itself to me. Oh, come over to my clinics or to my center itself for me to have a look at the recordings that they have made at that point of time. So especially for patients who have symptoms of palpitation, which is transient, very short-lived, this will be really a good device to be to own and actually to have it for them.
Now, Alvin, I want to ask you, can you kind of walk us through how people would actually use these devices? And you have two versions of this device, correct? Of Cardia Mobile.
Yeah, we do have two devices. Okay, one actually is a single lead, and the other one is a 6 lead. So the one I have here is actually a 6 lead, and they actually have a electrode behind. Mm-hmm. While the single lead is just 2 panel electrodes. There's no electrode behind, and for 6 lead, I think the difference here is that it provides more visibility in terms of, to doctors in terms of the leading indicators, because it is able to capture more information. While the
Does it capture the information on an app?
Yes. So I think the first thing to do is actually, once you, let's say for example, a patient that has this device, the first thing they need to do is actually to install the app in their phone, create an account, and from there, I think once the app is installed on the phone, either Android or Apple, iOS, with that app itself, they can connect to this device. So this device actually connect via Bluetooth. For the previous generation, one actually uses ultrasonic. But in most cases, this device, in terms of versatility-wise, in terms of the signal-wise, this is a lot better. Yeah.
So do we wear it around our chest, or how does it work?
That's a good one, actually. Okay, for this device, you can just keep it next to you, or whether in your pocket, or in a case.
Okay.
So when a patient has palpitation, for instance, so he or she can actually bring this up and just place their finger on the electrode for 30 seconds. So this, and then you'll be able to record the ECG tracing into the app in the phone.
Okay.
So it's a lot convenient. Yeah, I mean, looking at this device, I mean, previously in the past, we do have 12 lead ECG, but to just record an ECG, I think that was really inconvenient. One, you need to take off your shirt and then
Correct. That's why I asked about
and stuff like that. And sometimes, if the leads are not properly placed, so you might not get a good reading as well. So with this, I think this pretty much simply under 30 seconds you get a reading. So you can do it as often as possible. Yeah.
I think the heart rhythm. So
Gary, for you, then it obviously helps a lot because you can literally get a historical record and catch all the irregularities. So whenever, say for example, I have heart irregularities, but your heart responds differently, right? So perhaps over a 1 week period, you take it over a couple. Anytime I feel any sort of irregularities, and then I send the collected data to you. You then analyze, and then you can make a much more informed decision.
Yeah, I mean, certainly it really helps physicians, not only an electrophysiologist, to make a diagnosis of abnormal heart rhythm, which sometimes appears in paroxysm periodically. It's not there all the time. So it definitely helps a lot. It has really revolutionized how we detect abnormal heart rhythm over the years. Back then we do have something called a rhythm card. It really is just like our business card itself.
Yeah.
Whenever patients start having palpitation, they're probably going to place it on their chest, but there are limits to it. For instance, some rhythm cards allows you to have 10 recordings at most. You probably loan it to a patient for 2 weeks or so like that. Then probably they need to return it to you after that. So, having a user-friendly wearable devices that records heart rhythm as an event recorder, I think that will be useful certainly in some cohort of our patients as well.
Now, either of you can answer this. What are some of the innovations of late that have been made it a lot easier to monitor our health from home?
All right, that's very interesting as well when you're asking that, monitoring heart from. Actually, I do come across people coming to me with certain devices that even allows you to monitor your blood pressure. Then it will send through a Bluetooth connection. It will send the data to the apps itself, and with the apps itself, we actually sort of sum it up over the weeks or months and send it over to your physicians. Some of them even have gadgets that can allow you to monitor your oxygen levels. We call it the SpO2, the oxygen saturation as well. And that also can be compiled within the apps and actually send it over to your physician as well. So we do see this coming more and more where people, when they are more aware and more vigilant on monitoring their, not only about heart rhythm conditions, but also their body functions, the blood pressures and things like that, make it accessible through an apps and digital, or I would say it's an era of digitalization in terms of health monitoring now. So we do have that. And that, I think, really started off from the time where, in the olden days, when we have implanted a pacemaker for people with slow heart rhythm. Back then, they need to come to the clinics for us to examine, for us to check, making sure the pacemakers is functioning well, the batteries is still long lasting and things like that. But then we begin to have more revolution in terms of patients who are staying a bit remote areas. We can actually give them a home monitoring device that communicates daily with the pacemaker and which allows the doctor remotely to monitor the patients who are on pacemaker as well. So that was on patient with devices. But nowadays, I think taking on from there, now we start having devices that allows patients who have no heart problems at the beginning, or those who have the heart problem but yet is not discovered or diagnosed yet, to allow them to do monitoring from home itself sometimes.
In fact, one of the things with this pandemic is the fact that people have now started to realize that telemedicine is ready for prime time because of all the equipment like this, very simple devices like this, that basically people in remote areas can still get medical advice from a doctor like you in an urban center because they can have these portable devices and then send basically the readings across to you.
Yeah. That's very true because in fact, over the 1 year plus when we are facing with this pandemic, my center has been actually engaging into teleconsultation as well. Okay. So we do start doing that, and I find that sometimes it's useful, especially for patients who are on follow-ups. They would like to look at their monitoring of their heart rhythm and things like that. You know, they do go through that sort of platform as well. Yeah.
Now, sorry, Gary, Alvin, any thing you want to add to that?
Yeah, I think one of the experience that for myself as well. I mean, during the first MCO, there's limited mobility and having I do have this at home. So at a point, there's palpitation. Of course, is you can't go out, and then yes. Of course, having to being healthcare and get to know a lot of cardiologists as well. So I actually did this and sent it to a cardiologist friend of mine to see, hey, is this okay or not? No, but in most cases, I think this device actually can tell you whether it's normal or not. It is when you do encounter something abnormal, like certain signals, then you might want to. It's a very convenient device, actually, peace of mind. You can just download the ECG tracing and then just WhatsApp it over, or even to email it over to your cardiologist, and they can have a look at it and they can just verify, is this really normal or not. So this is something that is really convenient, and this one experience that we had during the first MCO was
Taking on from what Alvin mentioned just now, so the very important thing is, when you have recording, event recorder where at hand, you manage to get some recordings and tracing of your heart rhythm. It's always good to verify with your physicians or your doctors on the findings and things like that. So it makes people a bit more aware of their heart rhythm problems and sort of verify whether the palpitations are something sinister or not. So I think it's useful for a lot of patients, whether they have symptoms or no symptoms, or just fairly they just want to know whether their heart rhythms are normal or not.
Now, Gary, final question for you.
Yeah, sure.
What tips could you give our audience in terms of generally looking after their heart health?
Well, that's very interesting questions. I do get asked a lot wherever I go about this. But basically, from a doctor's point of view, I always say that, a good, healthy lifestyle is very important. All right. Balanced diet is also equally important. But at the same time, picking up on subtle symptoms that's occurring on your body itself is also equally important, because when you act on these subtle symptoms, you check it out. And then, in terms of symptoms that appears periodically and you check it out, you'll probably be able to pick up problems much earlier and render appropriate treatments at an earlier stage, therefore minimizing the damage in long term itself. But I think that's very important to take on. Do not minimize the symptoms that you may have actually at that point of time.
Now, gentlemen, thank you very much for taking your time to be on the show.
Okay, sure. Thanks, Brian. Thanks for hosting us today. Yeah. Okay. And stay safe and stay healthy too, everyone.
Yeah. Thank you. I'm Brian Fernandez, and we've been speaking to Dr. Gary Lee, consultant cardiologist and electrophysiologist at Thomson Hospital in Kota Damansara, as well as Alvin Lee, CEO of BioD Medica, on Biztech's Health and Wellness Show. This video will be on our Facebook and LinkedIn sites, as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thank you very much for tuning in.